So, hello and welcome. My name is Patricia Ferguson. I'm the Vice Chair of the Diversity and Inclusion Council, and I also serve as a Senior Research Analyst on Chamberlain's Institutional Effectiveness Accreditation and Research Team. And I'm pleased to welcome Dr. Kenya Beard, who is our new Associate Provost for Social Mission and Academic Excellence for Chamberlain. And we'll just be getting to know one another today and having a quick chat.
Sounds good.
Awesome. So can you just tell us a little bit about yourself and what led you to Chamberlain?
Sure. I entered nursing over 30 years ago, believing that nursing had the power to improve the health of the nation, and that all we needed to do was teach patients about health promotion and disease prevention. But several years later, I read that many patients needlessly die for reasons totally beyond their control. They die because the air quality in their community is poor or because the quality of healthcare is less than stellar. The deprivation of an individual's right to achieve their highest level of health, it really contributes to health disparities, it results in poor health outcomes, and it results in shorter lifespan. So I thought, what can nursing really do to improve the health of the nation? And 20 years ago, numerous publications, including the Sullivan Commission on Diversity, it reified the importance of greater workforce diversity and how the absence of diversity contributed to healthcare disparities. And those disparities are really the differences in how some are treated and the poor outcomes that are experienced. So I thought I could help diversify the workforce. So my research initially focused on the role of faculty in strengthening racial and ethnic diversity in nursing. However, the publications reveal that we miss powerful opportunities to improve the learning environment when we view underrepresented minority students through a deficit lens, and the majority of our resources, we use them to target what the institution believes that these students need or don't have. And I realized from the studies that I had to broaden my lens. What about the needs of faculty in teaching culturally diverse learners, or the needs of the institution, for that fact, in ensuring empowering learning environments? So my research definitely widened. I began to examine and disseminate what faculty and institutions needed to strengthen diversity. So you asked what led me here. We award the most BSN degrees to underrepresented minorities, and the students are racially diverse. And while there is an opportunity to strengthen racial concordance between students and faculty, the academic quality is so high, and we are graduating learners who have the capacity to improve the world.
Wow, that's incredible. Just hearing that journey of 30 years worth of work and pulling out and seeing that lens just widen through your research is incredible, and seeing how that connects to Chamberlain and our students and our mission. So that sounds great. Can you tell us more about what you'll be doing here at Chamberlain?
So as a national champion for social mission and academic excellence, I am thrilled that I have an opportunity to work with others to strengthen our ability to meet the healthcare needs of the communities that we serve. Social mission is the contribution of the school in its mission, programs, and the performance of its graduates, faculty, and leadership to enhance health equity and to address the health disparities of the community in which it exists. So as a national institution that's part of a global entity, CU is designed to serve as a leader in this space. Regarding academic excellence, being able to lead social mission efforts and team up with others to design innovative strategies that result in the reduction of healthcare disparities and the advancement of health equity, simply phenomenal.
Thank you. That sounds amazing, and I'm looking forward to seeing that work come through. So can you you mentioned this already, what social mission is, but can you talk more in depth about what that looks like and how it plays a role in Chamberlain's broader mission to educate, empower, embolden diverse healthcare professionals who advance the health of people, families, communities, and nations?
Okay, that's a lot.
It is a lot.
So social mission is more than just plugging content into an already content-rich curriculum. It aligns so well with the institution's mission that seeks to educate, empower, and embolden diverse healthcare professionals. I recently co-authored an article with Dr. Lisa Day where we shared the potential dangers when voices are muted and how institutions must graduate students who feel empowered to speak up. Can you imagine if a nurse receives report or an order from someone whom he or she believes is more senior to them and fails to provide a counter narrative because they feel that they don't have the right to speak up or against something? Patients would die. Patients have died. So yes, the social mission framework reaches beyond the curriculum and it taps into everything we do, emboldening us to consider how we decide who gets accepted into our program, how progression is determined, how we strengthen the capacity of faculty to teach diverse learners, how we measure and determine success, the type of research we conduct, the colleagues we hire, the hiring and promotion practices, and even the clinical experiences we provide. So yes, social mission aligns directly with Chamberlain's mission and our strategic priorities, which include how we mitigate structural racism, how we improve the health of the communities we serve, and ensure that we graduate providers who learn in environments that are able to dispel the myth of race as a biological construct.
Wow, just hearing you talk about those examples of the reality of what that looks like, the practice from curriculum to actually bedside, is just, it really makes you pause and think about our impact as Chamberlain. I'm really looking forward to reading that article as well. So you talked a little bit about this, but just to get more in depth, what impact will our social mission have on our community, our faculty, our students, our alums, and other partners?
Okay, another great question. Social mission serves as a framework that reveals our interconnectedness and interdependence. So as the future of healthcare shifts its emphasis back to community-based primary care and health equity, more opportunities will emerge for us to strengthen community engagement and determine the extent to which our actions result in healthier communities. For example, some faculty had to be sold on the idea that vaccine administration was a valid clinical experience for nursing students. And I get it. For some, it requires a shift in mental models. But with social mission, we ask the question first, how will this or that action advance health equity? Will it help promote access in the community? And can it actually mitigate health disparities? Yes, yes, and yes. And then is it part of nursing scope of practice? Another yes. So of course, assessment, medication administration, and evaluations are fundamental to nursing. So for sure, partnering with communities and providing opportunities for students to strengthen access and advance equity is a valid clinical experience.
Absolutely. I wholeheartedly agree. I'm a community psychologist by training. You are speaking my language. I'm always surprised to hear how that disconnect really exists, and how those things and how we can kind of bridge that gap now, with you kind of working on that and looking for those opportunities where we can be better partners, not only to our clinical experiences, but also to our students, to our alums, and the community at large, right? So what are some key success factors to realizing a social mission? You described it as a framework, but it sounds like a living, breathing thing. So I'm just wondering what success factors factor into that?
So if we look at the long-term objectives of social mission, we should see institutions of higher ed living up to their ideals and providing evidence that reflects their contribution to the communities that they serve, greater access to care, and better health outcomes. Using the prior example of vaccine administration, some of our campuses have already administered vaccines and helped to mitigate issues around vaccine access, and nursing schools should continue to seek out meaningful ways to reduce COVID rates and improve patient outcomes. That's social mission at work. If we examine short-term successes, we really should be able to, at Chamberlain, we should be able to reify our Chamberlain Care commitment and bring teams together to do all that we do with an equity and a social mission lens.
Yeah, and when you say that, that really strikes me as, this isn't just a problem for people who are already at work, nurses in field already. This is something that we can address as an institution, fostering this in students, helping them through that process. Because as you mentioned earlier, what happens when nurses don't advocate on behalf of their patients when they know something might not be exactly right? And how do we foster that as an institution? It's by these opportunities now. So that's just incredible. And as we have this discussion, I'm really cognizant of the fact that we are in Black History Month, right? We're celebrating Black History Month. Can you tell us what this month means to you?
So, Black History Month is a time to intentionally reflect on the historical and current achievements of Black individuals who come from a racially stigmatized group and acknowledge their undeniable achievements during a time when our society has designed policies and practices to keep them oppressed and in constant fear. Black History Month reminds me of our ability to be change agents. And despite what might appear to be unsurmountable odds, I think about individuals like Harriet Tubman, Martin Luther King Jr., or Sojourner Truth, and realize that we too can do all things.
Wow. Thank you so much for that. I wholeheartedly agree. And as being part of the Diversity Inclusion Council, I'm just so excited to have you here talking about all these different social missions and things like that that we don't always hear in the academic realm. I think it's important that we continue to have conversations and learn more about what social mission looks like in reality, in practice, and how we can strengthen our programs, curricula, our relationship with our partners and students. So I just want to thank you so much for taking the time and giving us so much valuable information.
Thank you.